Hi everyone, good afternoon and welcome to the webinar for Insider Tips for Applying to Medical School. My name is Nidhi and I'm a Moon Prep counselor, and we're just going to take you through some of the tips we have for applying to med school. So a little bit about us. So we both created this webinar. My name is Nidhi. I'm a Moon Prep counselor and I'm a SMD student myself. I'm part of the Brown Pleme. I'm a current master's student at the University of Oxford right now, and I will be an incoming M1 at Alfred Medical School in September. Darlene, who is my co-presenter on this presentation, is a DO candidate, a third year, and a BS and completed a BS in human biology at UCSD. So we both work for Moon Prep, and Moon Prep is an organization that can provide one-on-one remote guidance through the med school admissions process. We all have a team of counselors with years of professional experiences, and we specialize in med school admissions, the entire process for MD and DO, and also personal statements and essay and interview prep. If you want more resources from us, you can check out our column on Forbes at this link, or watch us on YouTube at our YouTube link. We've previously interviewed many different medical schools, dean of admissions, MD and DO, as well as med school students and the president and CEO of AACOM. So first, we're going to talk about a sample timeline on how to stay on track. So throughout your first year of undergrad, you'll want to maintain a high GPA and begin to take prerequisite courses to perform well on higher level STEM courses. Furthermore, you'll want to join a pre-med or healthcare organization, form strong relationships with healthcare professionals, and form strong study habits. In your year two of undergrad, you'll want to begin studying for the MCAT, continue to keep your GPA high, and continue to participate in a pre-med or healthcare organization. At the same time, you'll also want to strengthen your relationships with healthcare professionals and find great mentors along the way. In year three of undergrad, you'll be taking some higher level classes, and the application will definitely be nearing closer. So you'll want to familiarize yourself with the application, meet with your pre-med advisor, and create a list of possible medical schools. In year three, it's also important to take the MCAT, begin to write your personal statement, continue to participate in extracurricular activities and medical experiences. You can also send in your application as soon as possible once you've completed this basic checklist. Year four of undergrad, you'll also be able to fill out and send back your secondaries. The interview season is from September to February, so you'll be able to decide where you want to go to medical school by April 30th. You'll also want to fill out the FAFSA and, of course, thank everyone who's helped you along the way. These are an overview of the application types. So there is the American Medical College College Application Service, AMCAS, for most MD schools. There's the AACOMAS, which is the American Association of Colleges of Osteopathic Medicine Application Service. And finally, there's the Texas Medical and Dental School Application Service, which has the acronym TMD-SAS. To submit your primary application, you will need your transcripts, MCAT score, but sometimes you can submit it with your application without. List of meaningful experiences, academic research, clinical and extracurricular activities. You'll also need your personal statement, letter of recommendation, as well as any further supplementary materials that colleges may ask for on a case-by-case basis. For the personal statement, it's very important that you touch upon the activities that you've held dear and that have sparked an interest in the field of medicine. Between the ACOMAS, AMCAS, and TMD SAS, there are a number of key milestone dates that you should keep in mind. So first, the verification of applications. It usually takes 1 to 4 weeks, and you won't receive your secondaries until your verified application has been received by the school. Secondary essays are also sent back within 2 weeks of receiving. The interview timeline is as early as late June, but usually late August, and interviews continue through February or even spring. And finally, decision release dates happen as early as October or as late as May. You can be admitted, rejected, or even offered a waitlist position. A lot of people come off the waitlist much closer to start day. I've had friends come off the waitlist up to just about a month before classes were starting. So even on the waitlist, it's never really over until the classes properly start. Another thing is that it's really important to start building your medical resume early. So first, you'll want to do shadowing, either virtually or in person. Because of the COVID pandemic, there are so many limitations on shadowing opportunities. So here are some resources for getting around that. Web Shadowers is a great platform that you can use to complete some virtual shadowing. And have other, there are many other sites cropping up to pursue virtual shadowing on your own time. Volunteering, this can also be virtually or in person. A great way to volunteer virtually is tutoring, finding some clinical experiences, both virtual support and in person if possible. Volunteering is a great way to channel your passions, so you can really choose any field to volunteer in. I've had friends volunteer with housing outreach or at homeless shelters or even in a translation setting at local hospitals. If you can tie in an element of healthcare, that's great, but even if not, volunteering is always great when you can find a passion and apply it to show on your application and also have a longitudinal experience. Next, we have clinical experiences. So these can include virtual medical scribing, working in a clinic or hospital, and also EMT. Research is also a great item to include. So usually a lot of aspiring medical students join a lab either in their freshman or sophomore year, and many get published by their junior and senior years, or even if not, they show longitudinal research. So it's important to, if you do want to pursue research, to find a really great mentor who you can work with and you trust, and then go forward from there. Furthermore, extracurricular activities, there are a number of different opportunities. These don't always have to circulate around medicine, but make sure that you're specializing in a given area versus kind of taking a little bit of everything. So in this situation, showing depth over breadth is definitely important. It doesn't necessarily matter if you just show commitment to 1 or 2 activities for 4 years. It's better than having multiple shorter stints in other fields for the 4-year period while not really showing commitment and depth to any of them. And finally, leadership skills. This can really be anything, whether it's from your school's student government or student class board, or taking over a club or volunteering group, or even showing leadership within your own research lab or volunteer organization. All of these and so many more activities will really help start building your medical resume. And the key word here is early. So you'll definitely want to start in at the beginning of your freshman and sophomore years if you are really committed to a pre-medical pathway. Next, we wanted to touch upon how medical school admissions can be affected by the coronavirus. So we call it the Fauci effect, but since we've been living in a global pandemic, there have been an increase in applications. So AMCAS applications overall have been up by 17%. And in the last decade, it increased less than 3%. So this is a really dramatic jump. AACOM applications are also up 19%. There are also more virtual interviews offered. Texas A&M Healthcare Center College of Medicine offered 9% more interviews, for example. There is talk about more seats becoming available both across the MD and the DO scheme, but this really reflects the physician shortage in our country as well. So we can't rule out the fact that medical schools will expand to kind of suit this need in our country. So Darlene sent in some wonderful tips that I'm just going to share with you all today. So first, you'll need to be productive and follow your passions. She also really wants to highlight the importance of networking, gaining as much clinical experience as you possibly can, applying early and applying broadly, and making sure that you recognize that all aspects of your application are equally important now that more medical schools are holistically reviewing applications. Furthermore, not all advice is equal, so this is especially where you'll want to watch out for people trying to sway your path or make you feel like you're not doing enough. And above all, to be resilient, because applying to med school is difficult and you're going to face both triumphs and tribulations in the process. Now onto my tips. So I think during my entire process, the mentors I've had really shaped me incredibly, whether that was my lab mentors or mentors of my internships or even some of the great professors I had. I would say it's incredibly important to choose your mentors wisely and never be afraid to pivot if your research interests or mentorship preferences change. Additionally, don't be afraid to stray off the beaten path with regard to activities. I know that for med school applications, it can often be easy to defer into the research and pre-medical organization laden path, but for every one of those, it's also equally important for the classics and history majors to also pursue their interests and show that to med school admissions processes, and it usually makes for a lot more interesting of an application. So don't be afraid to stray off the beaten path and really pursue your interests, or better yet, see if you can apply your interests to medicine. Furthermore, meaningful experiences also make for the best stories, which is my next tip. So yeah, don't be afraid to do unconventional extracurriculars that can really help you stand out. Finally, never procrastinate. So as I said, the key word of the application process is early. So always have your apps done well in advance. You never know where you're going to run into a technical difficulty, like tonight hosting this webinar. But it's always good to be prepared in advance and have plenty of time to submit and make sure your submission went through during the entire process. And that's all the information we have today. This was definitely a shorter webinar, but we would love to work with you. You can schedule a call with us at this link or email lindsay@moonprep.com or even visit our site at moonprep.com. For med school admissions, we can offer tailored essay writing, interview prep, and help you select the perfect med schools that'll be a great fit for you. We offer really convenient hourly packages, no long-term commitments, and a full refund of unused hours. And yeah, so thank you so much for coming, and please feel free to email us with feedback. We have our first question. So I just see I have a question. Um, I actually had a question from someone right before this webinar. So while you're typing out that question, I'm just going to answer that question for them. So they actually asked me what kind of summer experiences would be best for tailoring to med school and more like internships and stuff. The answer to that is that I have seen people do everything from a space engineering internship for a summer to working at a startup to consulting to research. Research is often the traditional path when it comes to med school admissions, but at the same time, having creative summer experiences, as I mentioned, is super important. For me, I had quite the range. I worked in a startup that had nothing to do with healthcare for a summer. I also spent a summer doing public health research, and I also interned at a healthcare-oriented nonprofit. And of those, I would definitely say that each gave me many different insights into like life experience and learning about the different aspects of medicine. I would also really encourage people to check out opportunities in the field of health communications. So these can include more like health policy oriented internships or um, more and not hard bench research, but more applicable and clinically oriented public health type research. So those are all options that you can pursue. And I would really say have as many have like a broad range as you want, but as long as the experiences in your later years closer to application season do tailor themselves well to medicine, that would be the best. I have another question by MK. So do you have any tips to a high school student who's a freshman and can get into a BSDO program? So Darlene just sent in the answer for this one. So for BSDO, shadow a DO if you can, and continue to do research if you can, and gain lots of clinical experience. And above all, find ways to understand how the osteopathic tenets work and bring that knowledge to your application, to your interviews. Many BSDO interviews do ask you a lot about why the DO pathway as opposed to the MD pathway, and you want to make sure that you have a lot of experiences to speak to your interests in both medicine and the BSDO pathways. Yeah, so I see another question. What alternatives are there to getting clinical experience for high school students? Because currently it is difficult with COVID. Yes, it is definitely very difficult with COVID, but I think virtual shadowing for now is a really great opportunity. So anything you can do virtually is a fabulous option. I have a wonderful current sophomore right now who is volunteering virtually in a hospital setting in which she does like virtual guitar playing for the a ward of pediatric patients, and it's something that she's been doing more longitudinally, has turned into a really great passion project. Um, I've also had students shadow virtually, as I mentioned, Web Shadower is a great platform, and also really any virtual shadowing experience. There are some certifications you can get online that pertain to healthcare. There are like many free lectures and some online lecture series and programs. I know Stanford has one, and some of them can give you a certificate at the end. All of these are really great ways, as well as like online volunteering and auxiliary support for maybe a medically oriented nonprofit or healthcare organization. But yeah, all of these are really, really great opportunities to kind of show that you have this demonstrated interest in medicine. And at the same time, you can also focus on other aspects of your application, such as performing well in a classroom setting or taking leadership in healthcare related or volunteering related clubs in school. I had another question submitted to me about finding mentorship in the early years of undergrad. So I can speak to that a little bit because that's something I actually do have a lot of experience with. Um, as for finding mentors, it's really hit or miss, and it's a little bit uh, it's a little bit difficult to find exactly the perfect fit right off the bat. So for me, I had to try to work with a couple different research mentors, shadow the projects that they were doing before I found my mentor, who was absolutely amazing through the entire process. So I would definitely say that if you don't find it right off the bat, don't get discouraged, but make yourself available and open to meeting new professionals in the field. Go to networking events, go to research open houses or panels put on by your school's research facilities. Talk to your professors after classes, and really network with the adults and even the older students and postgrads in your school, because you never know where one conversation will take you. And at the same time, just really have a good resume, list of activities, and a good elevator speech about your prior research experiences on hand and at your avail if you find yourself needing it. And yeah, that is on mentorship. Oh, and I have one more question. So that is, I've been looking into the Brown Pleme, and based on your experiences, is it a great program, and any other tips on getting to this program? Amazing. So as I mentioned earlier, I am a student within the Brown Pleme myself, and having completed 4 years of undergrad at Brown, having taken advantage of some of the resources at both Brown and Alfred Medical School, I would definitely not trade it for anything. I had the best 4 years of Brown, and I think that especially for the Pleme, they give you so many resources both at Brown and at Alpert. As an undergrad, I had the wonderful opportunity to get involved with a literature review at Alpert that I still work on today. I found great mentors across the School of Public Health, the med school, and at Brown University. The guidance I received by my deans and the opportunities, whether they were study abroad or research or class offerings, were great, all while having the flexibility to really study whatever I wanted. And I even majored in public policy and anthropology, two humanities fields, while completing my pre-med recs, which you really couldn't often do in a classroom setting. Tips for getting into this program. So this especially, my whole team, don't be afraid to stand out in your activities, especially for BSMD and BSDO applicants. Much like med school, there's often a cookie cutter path that people tend to take. So, and that's just research, shadowing, and very, very medical or STEMmy activities. And while those are all great, don't do it at expense of cutting out all your interests in the humanities. So I kept up a lot of other interests. I was very involved in Latin at my school, and I did a lot of activities relating to that. I also edited my school's newspaper. And all through my path, I kind of kept my interests in the humanities and activism through the work I did. And one last question. When do you recommend is the best time to get a mentor during high school? So for this one, I think the earliest is the best, but also accumulating different mentors along the way, as cheesy as it sounds, they can definitely see you kind of meld and grow with time. So I got, I think, my first mentor, who was a professor of pharmacology at a local college, because I was really interested in seeing what research was like the summer after my freshman year of high school. And although I realized that bench research wasn't for me, she was a wonderful resource through the entire process. And through her, I was able to think about what did work, even though I realized that maybe lab-based research wasn't necessarily for me. I also met some great mentors during my sophomore and junior years, especially like as I got more and more involved in my interest in environmental activism and first responder training and disaster preparedness. I found great adult mentors through that. I also worked really closely with mentors at my old school. I was very close with some of my faculty mentors in the extracurriculars I did. For example, our newspaper sponsor and I were very close, and that professor actually wrote one of the best recommendations for me that I'm sure helped me get into the program. So short answer, there's really no best time, but at the same time, I think that it's great to start early, and then don't be afraid to branch out and get new mentors sophomore, junior year as time goes on. Wow, one more question. What do you think are the must-haves to get into the 8-year program, to a 8-year med program like the one at Brown? Okay, so for this program, for this question, it really depends on the program. So every program is different, and it's different in what they're looking for. We always tell students, for example, programs like Brown, the University of Oklahoma's humanities-oriented directed MET program, those really focus on well-rounded candidates who may have experience in the sciences and may also have experiences in the humanities. As for the must-haves, maybe I can boil it down to say that most candidates who are interested have they have like stellar grades and pretty good test scores, but they also want to see a defined passion in a given area. And I think at that level, leadership on the high community level or the state or national level really stands out. I wouldn't say that's a must-have, but I think that would definitely help you in your chances to get into a direct med program. But it really depends on the program. Some, like Virginia Commonwealth, really look highly upon volunteer hours. Programs like Rutgers looks favorably upon patient care and direct contact. Some of the Texas schools are very interested in volunteering and community service, along with more outreach experiences as far as what we've seen. But it really depends on the program. It really depends on the applicant pool that year. And more than anything, it really depends on how you're applying your passions to apply to the field of medicine. I think that's all the questions we have today. So thank you so much for attending. Apologies for the minor technical difficulties at the start. And please feel free to reach out to us if you have any more questions or comments.